Hi, I'm Dr. Peter Lind. One of the things we do if you have fibromyalgia or chronic fatigue, chronic pain type problems is have you fill out a metabolic assessment form. This is a symptom survey and it lists a number of different questions that are very important to figure out what kind of category you might have. For example, the first category that we're going to talk about is colon problems, and it's going to ask you different questions about your colon and your digestive system, as does the category following that, category number 2. Checks the stomach, asks questions about the stomach. On and on. Category 3 and 4 are related to other parts of the digestive system, and 5 and 6 are related to adrenal health. 7 and 8 are related to thyroid problems. And so we can figure out if you have blood sugar imbalances, that's going to significantly affect the energy input into your muscles and tissue, and that'll affect your fibromyalgia pain and symptoms. One of the things that happens oftentimes is your pain comes and goes, it gets worse, or it moves around, and that can be really quite related to the adrenal fatigue and blood sugar problems. Another thing quite common is thyroid imbalances, and again, the metabolic assessment form will ask certain questions related to thyroid function, either hyperfunction, where you get a rapid heart rate, inner trembling, just nervousness and those kinds of symptoms, or hypo type of symptoms related to thyroid, mental sluggishness, needing lots of sleep, hair falling out, weight gain. Those are significant symptoms that really matter to figure out what we're going to do. Well, once we get this metabolic assessment form filled out from you, I'll have a chance to look over that, kind of direct the course of care. Then we'll have a better idea on the metabolic testing that we're going to do. And we run large panels because we find most of the times that lab tests are done, and this is laboratory chemistry, they're incomplete. There's a lot of variations that we need to find out, so we run quite significant tests to find out really what's going on, and that might be your missing ingredient that is not found. So we do the metabolic assessment, figure out what's going on, and then I can direct a course of care related to the symptoms that you have and order the appropriate and correct lab tests looking for blood sugar problems, thyroid problems, lipid imbalances, and then put that together. And if we can accept your case, then we plan a program of care, and it takes oftentimes a long time, months and months, to unwind the problems that you've had over the period of years. So those are the steps we take. Hope this information has been important and valuable to you. If you need an assessment form, call our office and we'll get one right out to you. 503-581-6846. I'm Dr. Peter Lind.